Hi, hello everyone, welcome. I'm Gemma Cornwell. I'm the Head of Communications and Fundraising at SRUK, and I'm delighted to welcome you all to this afternoon's webinar. The subject today is how to make the most of online and face-to-face appointments with your doctor. And in just a couple of minutes, I'm going to properly introduce Sheena Campbell, but I just want to sort of quickly run through a couple of things for those of you who've not attended our webinars before, not sure about the format. So first of all, Sheena will give her presentation, and then afterwards you will have the chance to ask questions. You do that by pressing on the Q&A function. Usually it might be at the bottom of your screen or maybe at the top, and you'll write your question in there, and then we'll go through those after the presentation. We will be, as I said before, we will be recording this webinar, and we will send you that link round by email, so you'll be able to watch it back. And do keep an eye on our social media channels as well, because we'll publish a link to it there. And if at any point you would like to support SRUK, then we've made it easy for you. You can make a £5 donation by texting SRUK webinar to 70450. So great, thanks everyone. It does give me great pleasure to introduce Sheena Campbell today. Sheena is a communications manager for the Patient Information Forum, known as PIF. She runs training workshops designed to improve health information and communications with patients, and also reviews materials to make sure they're easy to use and understand. So thanks very much, Sheena, and I'm going to hand over to you now. Thanks.
Thank you so much. Hi everyone, I'm just going to start sharing my screen. So hopefully that will work. Hopefully everyone can see that now. So as Gemma mentioned, today I'm going to be talking to you about getting the most out of your appointments. If you do hear a strange background noise, apologies. We've had some thunder here and I've had to give my dog a Kong to distract her. So if you hear a very strange noise in the background, that's what that is. So just going to tell you a little bit about who I am and PIF just before we get started. So as Gemma mentioned, I'm the communications manager for PIF, and my role is to really promote excellence in health information. PIF's the UK membership network for anyone producing health information. So SRUK are members, but we also have NHS trusts, other charities like Macmillan Cancer Support, for example. And the idea is that it's kind of a knowledge sharing and really hoping to make patient information accessible to everyone and allow everyone to have the information that they need to make informed decisions about their health and wellbeing and care. We also run the PIF tick, which is the UK quality mark for health information. So what that means, and you might have seen it on some of SRUK materials, is if you see the PIF tick, you know that that health information is being produced following a 10-step process, which includes that it's evidence-based and up-to-date. And that was brought in when the NHS stopped running its information standard as an assessed scheme about 3 years ago. So you might have seen us in that way as well. So today we're going to be covering a few different things. Going to briefly touch on why it's so important to make the most out of your appointments, which obviously most of you probably think it is, as you've decided to come to this webinar today. Going to briefly touch on shared decision making as well, because having appointments and making the most of them is really crucial to being a partner in shared decision making. I'm going to run you through some tips on preparing for an appointment, and also what you might need to do slightly differently if you are having a virtual appointment. Some communication tips for during the appointment, what you can expect afterwards, and what you can do if perhaps your expectations for that aren't met. And just finally, we'll finish up today with some kind of top tips. So, as I said, I'm sure you all think appointments matter because you're here today, but we all know there's a lot of health information out there now, and it's not always easy to kind of filter through what's relevant to you. But actually, when you have appointments with your doctor or maybe a nurse specialist, it's an opportunity to ask the questions that you really want answered and actually concentrate more on what is important to you. It also might give you the opportunity to be signposted to trusted sources of information like SRUK. And it can also be prepared for your appointments. If you've got lots of different specialists, can really help, because I know that sometimes if you're seeing different departments and they haven't always got all the information from other departments, it can be quite difficult, and you can spend quite a lot of time just explaining what appointments you've been to in the last couple of months. Ideally it would all be joined up, but as we know in practice it's not. So while the burden shouldn't be on you, if you are prepared, then hopefully you can really make the most of that time that you do have with your doctor or nurse specialist or any other healthcare professional. So appointments are really crucial to shared decision making, and you do have a right to be involved in any decisions made about your care. And appointments are the time when you can really make it clear to the healthcare professionals you're working with what is important to you. And you should always be given information on the benefits and risks of any treatments that you're offered. And it's okay to ask questions, and it's okay to go back over information. It's okay to ask for information to be repeated. And it's also okay to make suggestions based on your own research. It can be quite difficult to challenge the status quo, but sometimes we do need to actually challenge, particularly again if you're working with potentially lots of different departments within the hospital and you might be getting conflicting information. Now, it can seem like just another acronym that gets used in health information, but we actually think it's a really important one, and it basically means that anytime there's a treatment decision, you should always be told the benefits potentially of that treatment, the potential risks, if there's any viable alternatives, and also what would happen if you did nothing. So you should always be told that, and if you're not, you can sometimes use that as a basis to starting to think about the questions you want to ask before your appointment as well. And you can find more information on Brown on the NHS website, but it's quite a useful framework because it means that you'll have all the information laid out for you in any treatment, and then you can decide what's best for you. And this is a legal right as well. Shared decision making is a legal right. It was enshrined in a court case called Montgomery versus Lanarkshire, that you have the right to make decisions about your care. So prior to an appointment, it's a good idea to sit down and think about what your main priority is. You might have several different concerns, but it is a good idea to try to prioritise them, because as we know, you don't always have a huge amount of time. So think about what your main priority and what's most relevant to the particular healthcare professional you're seeing that time. Always try to write down some questions you want to ask, or maybe main points you want to cover, because we all think we're going to remember all of that, and then actually you get into the appointment and you realise that you get out of the appointment and you realise you've forgotten something. And even make sure you refer back to that list of questions during the appointment as well. Recently been going through quite a lot of appointments myself, because my dad was in the process of getting onto a clinical trial, and did a list of questions, and then realised when he came out of the appointment that he'd forgotten to ask some of the questions on the list. So do actually refer back to it. If it's your first appointment with a new doctor or nurse, try to provide a bit of background information if you can. Again, ideally everything would be joined up and everyone would have all the information, but we know that's not the case. So if there's anything really crucial you think on previous treatments or major symptoms you've had between your appointments, summarise some of those key points so that right from the start you know that they've got the crucial bits of information about you. Do make sure to complete any pre-consultation paperwork. So, and that's now increasingly might be coming through some of the online tools and personal health records. So, and if you do need help completing any pre-consultation paperwork, then make sure you ask for it as well. You might need some provisions for your appointment. So it might be an interpreter, you might need someone with you, and that's absolutely fine. So think about that. If you have a really strong preference for a particular type of consultation, then ask for it. So you might actually prefer a remote consultation because you might be going to a site that's actually not that local to you, or you might have been asked to attend several appointments in a row and be having some pain or some fatigue, and you actually would prefer a virtual, or you might feel very strongly that you want a face-to-face. And if you feel that way and it's not something where you have to be face-to-face, then don't be afraid to ask. the one advantage I would say of the last couple of years is that it's showing that we can do some things virtually if it's appropriate and if it's what you want. And as I've mentioned, decide if you would like to have someone with you, because it can be difficult to take in all the information as you're kind of being told it, particularly if you've recently diagnosed, or if you're having a slightly different symptom perhaps than you've had in the past. So it can be useful to have someone there just as another pair of ears. If you are having a virtual appointment, then there are some different things you might want to consider. So find somewhere that you're comfortable and you're not going to have, if possible, people coming in and out. So I know that's not easy and it's not possible at all for some people. You might not have the privacy, but if you can find an area where you're not going to have family members wandering through, if you don't want them to hear the consultation, then think about that. If you're having a phone consultation, then be aware it might come up as no caller ID on your phone or something similar. So if you've got a block system on your landline, for example. If you're having a video appointment, try to think about lighting, and that's really important if you want to show a physical change, such as like skin color changes, and you might want to think about taking some photographs and sending them through or sharing them during the consultation, because they can have better clarity, again, particularly for if you kind of want to show physical symptoms like skin changes. And again, if you feel that virtual consultation is not appropriate for you, then do ask for a face-to-face. Obviously, there was one point where it was very difficult to have a face-to-face, but now you can have that as an option. Or it might just be the type of virtual consultation. A patient I did some work with recently, he was deaf in one ear, so he was quite happy to do a phone consultation, but really struggled with video consultations because of the sound. One thing that I haven't actually mentioned on these preparing slides, but it came up when I was doing some work with a patient group last week, is also the All About Me tool, which some of you might have used. And a lot of the patients were saying it's really, really helped them. And on that, you can record your preferred means of communication, how you like to be addressed, how you like to take medication, all kinds of things. And quite a lot of the patients actually said that they found it really opened up conversations. And I think someone said, you know, the doctor was asking about me as a person for the first time. So that's called All About Me. So that's also worth checking out. Apologies, it's not on the slide because I submitted them prior to having that meeting with the patients last week. So during your appointments, as I said, kind of set a clear agenda and actually decide that with your doctor or nurse. So you might have a different priority to them. So discuss what both your priorities are for the appointment and then decide how you're going to get what you both need out of it. Do try to be as honest and descriptive about how you're feeling as possible. I think we can all be a bit guilty sometimes of saying, oh, I'm fine, or getting on, and not really saying how we actually feel. But the best way to get the most out of your consultation is to be honest. So if you feel like your symptoms have worsened, or if you're just feeling particularly low about the symptoms, do talk about that. I've mentioned it before, but do ask questions. And keep asking questions until you feel you have all the information you need. It can be, sometimes you can ask a question and with the best will in the world, a lot of healthcare professionals use a lot of jargon, and so they'll kind of spout off something that as far as they're concerned does answer the question, but you might still be none the wiser. So ask them to clarify, ask them to repeat if you need to. I know the listening one seems quite an obvious point, but again, it can be quite easy sometimes if you are quite nervous, or if you're tired, or if you're thinking about the next thing you want to bring up, to not actually listen to the answers that are given sometimes. So do try to actually be engaged in the conversation as it's happening. As I said, do ask for clarification, and something to help you to digest the information after the consultation is to make notes, or just ask if you can record the conversation. again, going back to my experiences recently, when my dad was first going through the clinical trial process, it was at a point when you could still only have one person with you in consultations. So my parents were going and I couldn't be there. So they were recording the conversation so that I could hear afterwards. But also they found it actually really useful because then they were playing it back at home and saying, oh, that is what they said about X, Y, and Z. And I think particularly if you're being presented with different options sometimes, and that risk benefit information that we spoke about earlier, that can be really useful. While appointments are by their nature limited in time, do give yourself time to process the information and make sure you do ask for it as well if you feel you need it. Just say, oh, can we just stop for a second while I have a think about that, especially if you're being asked to make a decision. And don't feel rushed to make a decision. While some treatments might need to be administered more quickly than others, you can take time to decide what you want to do and what's best for you. Appointments do tend to focus on the physical. So if you are having any particular concerns for mental health and wellbeing, do raise those as well. I think particularly in the last couple of years, lots of people have struggled, and particularly if you've had to isolate or your treatment's been more disrupted than usual. So do ask for help in those areas as well as the physical areas. It's a good idea to check if there's other places you can get additional information, particularly I think with conditions like scleroderma and Raynaud's, where there's not always as much knowledge potentially with some healthcare practitioners unless they're specialists. So ask where you can find extra information, and also it means you've got time then to digest the information in your own space when you've had a bit of decompression. Do ask for contact details as well. So if you're particularly, again, if you're seeing multiple different healthcare professionals, ask who the best person to contact is for whatever your main priority is. And your doctor or nurse should actually summarise at the end of the appointment what the kind of key points are and what will happen next. Again, at a different patient focus group a couple of weeks ago, someone said that their GP sends a bullet point summary after every consultation, and I was just like, that's a brilliant idea. It would be great if everyone did that. But you should get a kind of oral summary of what's been discussed to make sure you're both on the same page as well, and telling you what will happen next. So after the appointment, you should get confirmation of any appointments, tests, treatment dates, but don't be afraid to go back. Quite often we think of questions after we've actually finished the appointment. So don't be afraid to go back and say, oh, actually, I'm now more concerned about X, Y, or Z. As I've said, do make use of other reliable evidence-based sources of information to help you make those decisions, particularly if you have been presented with different treatment options. This next one's more of an admin thing, but it can actually be quite upsetting sometimes when it happens, particularly if you have signed up so that you're copied into any letters that are sent to your GP if you're seeing a hospital specialist, for example, because quite often those letters end up being typed up quite a while after the fact, and then you're copied in to a letter to the GP and it says something that actually you've dealt with separately or you've already had a letter about, and it can, that side of things can actually be more stressful sometimes than the appointment themselves. So if anything's unclear about whether it's something you do need to take action on or the timeline, then do just get in touch with them and ask. And you might see that information has appeared in your personal health record as well after the appointment. So my kind of top tips are, do prepare for any appointments in advance, particularly if you're seeing a new consultant or someone who perhaps, or you're on a slightly different care pathway to where you've been before. Do ask questions and ask more questions. Look for reliable evidence-based information to help you make those decisions. And do try and set that agenda in partnership with your doctors and nurses. Try to work as a team with them. But it's really crucial that you do have that right to information so you can make informed decisions. So ask and ask again. You should never be told that you can't ask questions. And if you don't understand something, it's because it hasn't been explained properly. It's not your job to make sense of complex medical information. It's healthcare professionals' job to explain it to you in a way that allows you to make those decisions. So that's why we just encourage you to always ask those questions. And that's the end of my formal presentation. I've put my email address on there just in case any of you do think of any questions after that you wanted to ask me, and also just the websites, the PIF and the PIF tick, in case you wanted to take a look at those and find out anything else. So thank you very much for having me.
Great, thank you. Thanks, Sheena. That was really interesting. I know I personally was writing down some tips there. It's really important to remember that, yes, you're right. It isn't our job to understand the really complex information. We should ask questions. And the amount of times I've come out of a doctor's and thought, I can't remember actually what they said. So recording it is a great idea. So, yeah.
I was actually at an event about a month ago, and there was a speaker whose child had been diagnosed with a life-limiting condition, which is obviously probably one of the worst things you can be told as a parent. But when he and his wife got out of the appointment, they couldn't remember the name of the condition because they were in such shock and in such pain. And so then they were trying to Google it, and they couldn't remember exactly what it was called. And it just shows, that actually not being given the time to process that information, and also that you don't necessarily remember something you think you would really remember.
Yes, you think you would remember the name of, exactly. Great. Oh, well, thank you. We've had a couple of questions. So one question from Kathleen. She asks, are consultants happy for you to ask to be accompanied for an appointment in the current state of things?
Yes, so as far as I know, all hospitals now, you're allowed at least one person. I'm not aware of any that aren't allowing that now. But if you particularly feel you need an advocate, and for some reason maybe an individual hospital's having a bit of a lockdown because they've had a resurgence in COVID cases, if you really strongly feel you need an advocate with you, then I would say absolutely push for it. And if they won't let you do that in an in-person setting, then maybe say, oh, well, can we do it remotely so I can have someone in the room with me via video? So if it's something that you really feel you need someone with you, then I would say, push for it. But at the moment, as far as I'm aware, the general restrictions are not in place. So you should always be able to have someone with you.
Great, thank you. Another question, actually, one that I was wanted to know about. So Edith asks, where can I find information about All About Me? Is it on the NHS website?
Yes, you should be able to find it on the NHS website. But if you have any problems, then I can share a link directly to it, which maybe you could send out when you send the recording, Gemma.
Yeah, good idea. Yeah, that'd be great.
I'll put a link maybe to Bran and All About Me on that as well.
Yes, brilliant. Thank you. And actually, on that, Sarah's asking, please can you show the website addresses again? I didn't write fast enough.
Let me just share my screen. Pop that up for a second, so give everyone time to
exactly, won't rush on with but, so with the All About Me information as well, is that something that most GPs know about, or is it something you would have to make your GP aware of? Or
I think probably it's something that's more widely used in hospital settings at the moment.
Okay, right.
But there's been a big campaign actually this week because launched to kind of raise more awareness of it, so hopefully it's going to be getting better and better. And they've just, PRSB has just done a new standard which kind of sets out how theirs is actually called Care About Me, but about how putting patients' priorities first. So I think we are starting to see a change in theory, but obviously we want to practice. But the reason I specifically mentioned All About Me is we've done this focus group with some patients, and all of them were saying what a big difference it had made in the hospital setting. So that's why I wanted to just flag that up.
Yeah, no, it sounds great actually. Yeah, it sounds obvious as well, but
I know. just think about what you want to be called. So say if your name's Samantha, but you want to be called Sam, it's things like that can make a big difference.
Yeah, definitely. Great, thank you. Right, we've had another question. What are good strategies for getting your doctor to make you a partner in your care, and treat you as though you are involved in the conversation?
So I think first off is asking those questions and making it clear that you do have an opinion, and particularly if you feel very strongly. And I know that particularly with Scudder and Raynaud, sometimes some GPs don't always have a huge amount of knowledge on the condition.
Yeah.
So you might even find yourself in a position where you're kind of more of an expert than they are, which obviously you don't want to go in and be kind of like big I am about it. But I think it's actually showing that you do have knowledge and you do have decisions, and referring to that brand, the benefits, risks, alternatives, and nothing, and saying, right, I have a right to be told this information. And obviously, hopefully that should be a positive conversation. If it's not, and then you feel you need to kind of push it on further, then it is a legal right. And you can refer to the court case, which is Montgomery versus Lanarkshire, which actually enshrines in law a patient's right to be involved in decisions about their care. But hopefully it wouldn't reach that stage. And once you should, because quite often I think we just get so used to the status quo of like doctors know best, and we don't challenge it. And actually, when you do ask more questions, sometimes they're like, oh, maybe I'm not explaining this very well. And I think we're all guilty of it. When you're really familiar with a topic, you use words that other people wouldn't understand. So if you're a mechanic, you might be going on about carburetors and fan belts, and someone else might be standing there going, what are you talking about? And it's the same with the body. I think with doctors, they forget that other people just don't use these words that they use in a normal
Great, thank you. So Sarah says, sorry, because she joined late, but she said, how much detail is shared with my GP, as I feel my GP and surgery are unaware in a different trust? So I think, how much is shared?
So you can opt in to be copied in to any letters that are sent from the hospital to your GP. So that will give you a better idea of how up to date they should be. It can be difficult, particularly if you're at specialist units kind of in different NHS trusts all around the country, to get that joined up. So that's why I'd really recommend putting together almost like, it sounds bad, but almost like a briefing document on yourself with like the things that you most want them to know. So if you're seeing someone new or you're going to GP, you can say, right, this is the treatments I'm currently on, this is what my, and it's a shame that as patients we have to sometimes take that responsibility on ourselves, but until things are kind of more joined up across the whole NHS, and at the moment with digital it is starting to happen a bit more with personal health records, but we know it's still not perfect and it's very dependent on which area you're in sometimes as well. So having that kind of cheat sheet almost to yourself that you can kind of put in front of people's faces and say, no, like, let's not have the same conversation I've had with the last 5 people. This is what's happened. This is what I'm talking about now.
And actually, I think Anita's question probably links on to that. She's asked, what are our rights to obtaining copies of our health records?
So you have a right to copy of your health record. A lot of it is through the digital tools. So you can sign up, but you have the right to request any kind of records that the GP holds on you. The Patients Association actually did a guide on that, quite a detailed guide to accessing your patient records about a year or two, probably. Actually, COVID's completely warped my sense of time. It's probably about 2 years ago now, which kind of set out exactly how you could go about it if you want to request specific records that are more in depth than just kind of on your GP app. So again, I can pop a link to that to you, Gemma, and that you can circulate the slides if you want.
That would be great. Yeah, thank you. Really useful. We can put them on our website as well. So great. Now, I don't know whether this is something that you do cover, but somebody has asked, what's the best way to ask to be referred to a specialist in your particular condition rather than a general rheumatologist?
That is a good question. I think while again it seems horrible because it puts a lot of burden on you, but it's to do the research to find out who's leading the way, and then give a specific name that you want to be referred to, rather than just saying, right, I want to be referred to X. And actually, a surgeon I was speaking to a couple of weeks ago was saying that there's a website you can look at and it shows how many surgeries someone has done, and he was saying sometimes the people that have their name out there a lot are the ones that are doing a lot of the research, but they're not actually doing the day-to-day surgeries. And and actually sometimes if you look at the volume of specialist surgeries, so I think he was an orthopedic surgeon, and if someone's doing a high volume of very specialist surgeries, that can actually be a better indicator of that consultant that you really want to try and get in front of. I can't remember off the top of my head what the website was called, but I think I did make a note of it, so I will try to find that as well. I would just say, yeah, do your research, find out who's leading the way in these areas, and go in with a specific name rather than just saying, I don't want X. I think it's always good to go with a solution as well, like I want to be seen by one of these 3 people kind of thing.
And with that, what are your rights to insist that you are referred to that person? Do you have rights, or
you have a right to choose who provides your care?
Right.
The practicalities of that. Yeah. If you're talking about it, like ideally NHS only, without having to veer into anything private, it's not always going to be possible. Yeah.
Okay. Thank you.
Yeah, you do have a right to choose who provides your care. So in theory, you should be facilitated, particularly a rarer condition where there's less people specialists.
I think sometimes we don't know if we can ask for that or not. Yeah, so great, thank you. And actually, you sort of touched on this already, but somebody's asked, how do I help my GP to understand more about my condition? She's obviously not an expert, but is unaware of the far-reaching symptoms, and it's hard to be taken seriously.
Yeah, I think that's a problem that a lot of people with rarer conditions face, actually. I would say, obviously, SRUK does have some resources that you could take in with you, and kind of say, like, this is how wide-ranging the symptoms are. But even sometimes, if you want to make it more personal to yourself, kind of saying, these are the different departments I've had to deal with in the last year, where you're potentially going from, cardiology to dermatology to somewhere else, within the space of a couple of months, even, not huge amounts of time, and kind of just to show them, like, this is the reality of what I do on a weekly, monthly, however often basis, to kind of bring it home, because I think sometimes it's easy to forget once someone leaves the consultation room and it's just like, oh well, that's my bit done, and they sometimes forget. Then you've gone to another consultation and another consultation and another consultation, and so just even pointing out all the different departments you're in contact with can sometimes bring home actually how challenging as a condition it is to manage. Because I think that is one of the things that's particularly challenging. It can take a long time for diagnosis, and then you are dealing with lots of different departments. I was speaking to a lady with scleroderma last year, and she was just listing all the different departments that she would go to on a hospital visit, and the different sites as well that she has to go to. And it's quite a lot. It's a lot to deal with. It's the practical side of it, aside from anything else.
Yeah, definitely. So yeah, well, actually, that has been very useful, and we've had somebody saying thank you very much as well, I mean, I think all of the questions have been answered now, so I guess we can just give people another couple of minutes in case there's any other last questions coming in. But yeah, it's It is, it's really important. And I like your acronym BRAN. That is really useful to have that in mind when you're going and preparing. I guess preparing is one of the key elements as well. So actually another question just come in. Oh yeah, so it's from Siobhan, and she said she was only diagnosed yesterday. So thank you so much. This has been very helpful indeed. So good, Siobhan. Glad we could help. So yeah, so we will, obviously we've got, you've got some good links to send us, and we will follow up with basically what happens now is that we will email everybody after the webinar with a link with all the links that you've mentioned, but also a link to the recording of this webinar, so that if there's things you've missed, or you want to check out those website addresses again, they'll all be there. And then also what we do usually do as well is include a feedback form, because we do really value your feedback, and it's really helpful for us to know what you found useful, or anything else that you'd like to know, any future webinars you'd like to see,